Hello, 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 my friends. Jill Osborne from the Interstitial Cystitis Network. Happy holidays. Can you believe it? It is the second week of December. Time is flying by so very quickly. So it is time for another live IC support group meeting. And I try to do these every Sunday. And I do these for patients because I want you to know that you're not alone. I want you to get hope. I want you to know and see and hear and have a chance to talk with another IC patient who's come out the other side. There once was a time when I was very, very seriously ill and barely able to walk, much less function. And today I am symptom free the great majority of time. And so I want to educate you. I want to encourage you. I want to inspire you. I want you to have a smile at the end of the meeting today. I really, really do. So normally when I do these meetings, I do a little 30-minute intro and then I will take questions. And the thing is, hold on. Hold on. Hello? Yes, I'm just starting a live support group meeting. I just started it. Okay, you can come on in. Okay, bye. Okay. Oh, my friends, my friends, my friends. What a time we are living in. Now, I want to say something. I want to start this meeting off with a reminder to every single one of us, myself included, that as much as we want the holidays to be joyful, they are indeed quite stressful. Whether you are not feeling well. Hello, Peggy from New York. Hello, Donna. How are you, hon? It is a sad fact that as much as we want this holiday season to be a moment of joy and a moment of love and a moment of kindness and a moment of gratitude, it is also a time when the challenges of life can overwhelm us. Now, whether again things haven't gone your way for one reason or another, or you're not feeling well, or you have a new diagnosis, or you're worrying about somebody in your family who's struggling, or you're grieving, or if you're overwhelmed by the news of the day. Hello, Gay. So nice to see you, hon. So nice to see you. I want to remind every single one of us that we can't change what's happening in the world. We cannot. It is a dark moment in time for humanity with what is happening in the world today. But here's what we can change. And this is what we must do. Rather than grieving over a war, as hard as that is, we can bring peace to those around us every single day. It can be very, very overwhelming to think about trauma. I want you to think about kindness. I want you every single day to find somebody who needs a smile. I want you every single day to commit one random act of kindness. I want you to get out of your house and I want you to say happy holidays or good morning or good evening to people who could use a lift. That's what I try to do every morning, because I have an empty home now. And every single morning I get out and I walk the neighborhood and I say hi and happy holidays to every single person I meet. And I've got this lovely older man who walks this gorgeous Scotty and he drinks, he's smoking a big cigar. He just lost his wife last May or last March. Oh my God, I love to see him. I love to love on him in the best possible way, to ask him how he's doing, to to comment about how gorgeous his dog is. And it's a moment of goodwill and neighborliness. That's I think our world is missing right now. Don't you? And then there's another gentleman who also walks alone. He walks his dog Timmy, and he lost his wife this year too. And I always stop and ask how he's doing. And there are couples that walk together, and groups of women who walk together, and groups of men who walk together. Sometimes I'll go over to the park and walk around the park like I did yesterday. I only walked halfway around the park yesterday. And then this morning I did a ginormous, like 3-mile walk. I was out of my house by 8:45. I walked for over an hour because I know if I stay home in the morning and if I don't see other people and I don't have a chance to talk to other people, I don't have a very good day. And so I encourage you to not only let other people into your life, like I'm going to make this week, it's going to be my baking week. All of my neighbors are going to get cookies, but I'm going to try to make some Swedish cardamom braids for the first time this year. I'm going to carry cookies with me, little baggies of cookies. I'm just going to pass them out to everybody that I see. And I just think that this is the power that we have. The power that we have is to be gentle and nice and kind to the people around us. And I think if there's one lesson I've learned more than anything else in this last 6 months, it's that everybody you see has a story. I don't really think I understood the power of that until, okay, I don't want to cry. I have so much more humanity and kindness without any judgment now of the people that I meet because life is challenging. And so this is what I want for you. I wish for you that you have a peaceful and wonderful week. I wish for you that your IC goes into calming and remission. I want you to have a symptom-free holiday. God, I really want you to have that. I wish for you that people in your life will surprise you with a random act of kindness, but it's okay if they don't. It's okay if they don't. You know what? We're responsible for ourselves. They're responsible for them. We're going to do what we can do to put our body, our mind, our soul in a better spot. So anyway, I'm not as I've just been kind of cogitating this all morning. I just really wanted. Oh, honey, Peggy says, "Go ahead, girl." Listen, she says, "Go ahead and cry." I have cried so much this last week. It's hard. Okay, I don't want to cry now. I really don't want to cry now. I'm tired of crying. Hello, Kayleen. Now, the other thing is I'm sending out Christmas cards like mad. With anybody who would like a Christmas card, I would love to send you a Christmas card from my home to your home. And if you can email me your mailing address, my email is icnetwork@mac.com all the way through the end of the year. If anybody would just like a little sweet card of encouragement, I want to send that to you. I want to send that to you. Sandy says she would. Good. Email me, icnetwork@mac.com. Some of you have already gotten cards from me. Hello, Peggy from New York. Peggy said, I also walk around town. I love to stop and say hi, even to the ones that don't want to talk. I always say hi. I do too. I do too. Margie says she wants one. Email me, icnetwork@mac.com, your mailing address. I will absolutely send you a holiday card, a Christmas card. Because I think that that's what we all need to do is we just need to love on each other a little bit and comfort each other and just wish each other well. I want to wish you well. All right. So, what has been happening this week? Oh my God, this week has been it's been uh, a challenging week. Um, in the sense that everybody wants something. So I have a lot of companies that are calling me right now saying, "Can you do this? And can you do this? And can you do this by the end of the year?" And I'm like, I'll try." And so, one of the things that's absolutely near and dear to my heart that I consider to be essential to the work of the IC network is clinical trial recruitment. I talked about this last week. We have a brand new clinical trial testing a new therapy for IC seeking patients. That information is up on our website now. If you go to the IC Network website and you go down to the section on research and clinical trials, I've got not one, not two, but three incredible clinical trials offering new treatments, new pain management that you have the opportunity to participate in if you would like to do that. Um, and so um, this is hope. This proves to you that the IC movement is alive and well. This proves to you that really big things are going to happen in 2024. There's a lot of stuff happening in the pipeline right now. I am thrilled with what I'm seeing. I'm also absolutely thrilled to see the international IC organizations working together now as a group to create new resource materials for other national organizations with IC, for IC patients, et cetera, et cetera. Anne says, "Thank you so much for the beautiful card." Honey, I tried. Kayleen said, "I heard that if you say a simple hello to a depressed person, that can make them and those thoughts. I spread my goofiness everywhere." Yeah, I actually, I will share that I do have goofiness that I was quite tempted to. Here, hold on a sec. This was the goofiness that I was going to wear today. Oh, no, I mean, because it gets even better because it lights up. I love wearing this stuff at night walking. That's my goofiness. So be silly, my friends. Be silly. Listen, we only get to be on this planet this one lifetime. So for God's sake, I don't want to be serious. I want to be happy. I want to be joyful. I want to be fun. Ursula says, "Awesome." So anyway, getting back to the clinical trials here. If you are not responding to therapy, if you're getting worse rather than better, if you feel like you've exhausted the therapeutic options that your doctors have presented to you, here is your chance to try a cutting edge therapy that represents the future of IC care. So don't you dare give up. Anybody out there who feels like they're just done, for God's sake, call me. I give a great pep talk over the phone, no charge. If you are confused about what could be triggering your symptoms, if you are concerned that a doctor, for example, I got an email this morning, as a matter of fact, from a gentleman who had a wonderful doctor. That doctor retired. The new doctor came on board, not getting along with the new doctor at all. The new doctor wants to do a hydrodistension to look in his bladder because his symptoms are significant. Sandy, thank you. Got your address. And because this gentleman watches my meetings and because I review standards, that the patient said, "Hey, Okay, I'm not opposed to you looking in my bladder, but I want a low pressure, short duration hydrodistension to minimize trauma to my bladder. Will you do that? And the doctor had the audacity to say, "You are reading too much on the internet. That's not real." Ah, obviously, the doctor has not read the American Urology Association guidelines for IC. And I love that this patient was strong and firm and said, no, no, you may not do that to me. The American Urology Association has not suggested what you are proposing for over a decade. That's the way I want you to be. That's the way I want you to be. Strong, empowered, encouraging, educated, ready to walk in and have a good discussion about what your treatment options are, right? And come on. You're the boss. You pay them. They don't pay you. You're the one that's supposed to be making decisions here. You get a credibility check every single thing your doctor proposes to you. And that's why I said last weekend, never, ever, ever let anybody put anything in your bladder without telling you what it is first. Because you get to say no. You get to say why. You get to say, how is this supposed to help me? It's called informed consent. They're not supposed to do anything to your body without telling you what it is and what the risks are. End of story. And you're supposed to walk in, hopefully, prepared to know these touchy areas like, okay, yeah. Okay, I understand you want to look at my bladder. I get it. I was working with a patient on Friday, as a matter of fact. Again, and now this was a story, and honey, if you're watching, know that I'm saying this with love. Symptoms for over 20 years, severe symptoms, getting up 5 to 10 times a night, some moments of severe pain, not responding to any therapy in 20 years. I asked her, are your symptoms getting better with time? Or are they getting worse with time? Worse. She had never had a cystoscopy. Never. Now remember, what do I always say? If I'm in pain and I'm scared, I want somebody to look at it. Please tell me what you see. I am not interested in guessing. I want facts. And if I am in intense pain and it's been going on for a while, for God's sake, I want you to look at it. And the mistake that she made is she let fear stop her for 20 years. I do suspect that she has Hunner's lesions that have never been treated. And what do our guidelines say? If you're not responding to therapy, you're getting worse rather than better, take a step back, revisit the diagnosis. When is a cystoscopy or a hydrodistension with cystoscopy supposed to be done? When the diagnosis is in doubt. If you have a patient who is not improving over time, or if you, the patient, is not improving over time, it's time to look. So that was like concept number one for her is, girl, what you waiting for? You've been in pain for a long time. Let's get somebody in there to look at your bladder. And the challenge here too is that we've got a lot of anxiety going on. We got a lot of catastrophizing going on. But what if it hurts my bladder? Honey, then you're going to ask them to do a low pressure, short duration. But you can't let fear stop you. It's been 20 years. Don't you think it's time to let somebody look at it? Because it's not like it was 20 years ago when they were very aggressive. Today, we prioritize being gentle and not hurting the bladder. That's why we do a low pressure, short duration hydrodistension. And also, and I'm going to say this comes up regularly, regularly. Patients who have clear pelvic floor dysfunction. So I was working with another patient last week who pain on the right side of her pelvis, like on the right side of her bladder, but right side of her pelvis, pain that shoots down her leg. Oh God, and what did she do? She called it something. Really intense pain that would stop her in her tracks. Thankfully, it wasn't all the time, but it was fairly frequent, kind of scared the living daylights out of her. And in her case, it's like, okay, we've looked in your bladder, healthy, normal bladder, urine test negative. You had a pelvic floor assessment. What did it find? Muscles that were tight on the right side. Did you do physical therapy? Not really. Why? Because I thought a pill would make this better. I mean, I'm doing bladder treatments. But wait a second. They looked in your bladder. You have a healthy bladder. Your pain is on the right side. You have pain that shoots down your leg. Oh, and I think she even said that, yeah. She even said she was being treated. Oh God, what was that? I think she'd either had surgery, but it was a major SI problem, a problem with her SI joint. And so in her mind, she's like, but a bladder installation is so much easier. And it's like, but honey, your bladder's fine. I know you're having bladder symptoms, but your urine tests were clean. Your bladder wall was perfectly healthy. But what did they find? Tight muscles. What are you going to do about those tight muscles? Oh, I should do physical therapy? Yeah, but I didn't like it. Well, yeah, it's not the easiest thing in the world to do. Yes, it's going to be through your vagina or through your rectum, but that's the only way to reach these muscles. And what does our research show us? Our research shows us that pelvic floor physical therapy outperforms bladder treatments 2 to 1. Hello, David. Hello, Boria. Hello, Margie. So for anybody who wants a Christmas card, please send me your address, icnetwork@mac.com, and I would love to send you a Christmas card. Erin says, been taking PEA supplement and it's helping. Yes. I love it. And says, love your Christmas decorations, getting a new pelvic floor therapist in January. You can't wait. Excellent. And you guys, when you go to a pelvic floor physical therapist, you have to remember that their training is essential. You want to go to a pelvic floor certified physical therapist if at all possible. And understand that the most effective physical therapy is going to be myofascial massage, internal work. And if you have a physical therapist who doesn't want to do an internal examination or doesn't want to work internally or says, hey, let's try this biofeedback thing. They put a wand in your vagina or your rectum to try to teach you how to relax those muscles. That tells me that they're really not trained correctly because it's the myofascial massage that is the most important. David says, what supplement was helping for her? PEA. PEA. Hello, Boria. Nice to see you, honey. I hope you're doing well. Peggy says, I stopped my Elmeron today. I started taking PEA 500 once a day and Cystomen once a day to start off. On my 4th installation tomorrow, I am noticing a small change. I went out for a walk last night and stopped at the park and helped put up some Christmas lights. I was there for an hour. I came home and was in pain, but I did my routine to calm down my bladder. Emotionally, I felt so good getting out and doing something to help others. So Peggy, the other thing that I would have done is use a heating pad, a microwavable heating pad. Listen, I sleep with one every night. Most of the time it's sitting here right on my neck, but a lot of times I just put it right over my hips, right over my pelvis, because heat relaxes muscles. So if you feel like you're flaring after exercising, go to heat. If heat doesn't feel good and ice feels better, then use cool. But it's always, sometimes you have to go heat and then you go cool and then you go heat and you go. It's about finding what works for you, and hopefully your physical therapist and your doctor will give you some guidance with that. I don't like cold myself. Ugh. Lamo says, what is PEA? PEA is palmitoyl ethanolamide. It is a supplement that has been used in Europe for decades now for a wide variety of pain conditions. There's lots of research behind it with acute pain, chronic pain, surgical pain, chronic pain conditions like fibromyalgia, burning mouth syndrome, et cetera, et cetera. And we had a PEA IC research study released in 2019 that showed that 87% of patients using PEA reported a significant reduction in their pain and symptoms. And by month 6, many were pain-free. So it is a supplement called Peora, Peora, or PEA 500. Do I have it on my shelf up here? I do. Oh, PEA 500. So in the subtyping world, here, hold on. I gotta get all comfortable here. In the subtyping world, PEA is really ideal for IC subtype 5, central sensitization, widespread pain. We're going to do everything we can to calm our nerves down. Hello, Nancy. Anne says, what kind of massage should a pelvic floor therapist? Just myofascial massage. They're just basically going to be working internally and massaging these muscles with their fingers, just trying to get them to drop down and relax and release. Hello, C's from the Scottish Highlands. Oh, girl, I love Scotland. Half of my soul is in Scotland, and the other half is in Sweden and Norway. I have a hypertrophic pelvic floor disorder. Hypertrophic or hypertonic? Pelvic floor disorder, along with bladder and urethral symptoms, going through a terrible flare just now. Pelvic floor therapy was a game changer for me. Being aware of these muscles and visualizing their relaxation yet, and a hot water bottle. Thank you for all that you do. You are very welcome. And C's, I got to tell you, I love Scottish music. I am a huge fan of the group The Old Blind Dogs because they came here and performed live, and the singer Jim Malcolm. And half of the time I have my Christmas music is going to be Scottish Christmas music. I would love to be there during the holidays. So I hope that your holidays are really beautiful right now. Nancy says, I'm going to try and call you this week. Good. I'd love to talk to you. Oh, and also the other thing about PEA, no side effects reported in the vast majority of the PEA studies, extremely well tolerated, even for patients who are sensitive, myself included. And it's cheap. It's like $28 for a month's supply if you take 2 a day. If you take 1 a day, it'll last you 2 months. And so a lot of people ask me what I take, and this is what I take because I have a healthy bladder. There's nothing physically wrong with my bladder. My problem is tight muscles and hypersensitive nerves. And these are everything is so calm now. it's really amazing. It's shocking to me how much better my skin feels and all of my sensitivities feel now that I've found something that calms nerves down. Julie says, okay, hold on a sec. I told you a month ago I had a fulguration done back in August. I started having a flare here and there, but not as painful. But you mentioned to look up the Epstein-Barr virus. Should I be doing a detox? What would you recommend? I did a urine exam. No, I don't believe in detoxing at all. Detoxing implies that there's something that you've got to clean out, but the human body is absolutely amazing, and detoxing, in my opinion, does far more damage than it does good. So I don't see any reason to do any detox therapies at all, or coffee enemas or anything like that. And let me just go back to C's for a minute. Honey, you say you're in a terrible flare right now. What triggered your flare? What do you think triggered your flare? Okay, so Julie said she did a urine exam. I did have a mild UTI, which I'm now taking antibiotics for. Okay, cool. So now we know why you were struggling to the degree that you were, because you had a UTI. Oh gosh, and I was working with another patient this week who had a really rare UTI that next generation testing found. And it was like 70%. God, what was that? It's really rare and very, very antibiotic resistant. And the doctor would only give her one round of antibiotics for it. And so we pulled up some research that showed it needed a lot more thoughtful therapy, but she was having trouble getting her doctor to believe that legitimate medical research, if I remember correctly. Let's see if I remember that correctly. Peggy says, I have a purple lavender bag that I heat up and use it like I breathe in oxygen. Yeah, man. I could be wearing a heating pad right now on my back. The right side of my back is not happy with me. Lori says, had a fluoroscopy with injection into my SI joint, and it's a miracle how this helped with the pain and pelvic pain. Yeah. Yes, yes, yes. You saw a new pelvic pain doctor. She is amazing. I love it, Lori. Excellent, excellent, excellent. Hello, Sue. How are you, hun? Sue, I hope you had an opportunity to go hang out with some horses. Do you take 2 PEA or 1? I take 2. But I will tell you that when I run out of a bottle, I usually stop it for a couple of weeks and then I start it again. And it's been fine. It's what we call durable. The nerve calming effect really does last for quite a long period of time. I think the longest I've been off of it was like 3 months. And then once I start feeling the pins and needles in my skin again, that's when I know I need to go back on it. Lori says, what is a good multivitamin for IC? I can tell you exactly what a good multivitamin is. Hold on, let me go get it. No, I gotta go get a vest too. I'm cold. Hold on, I'll be right back. All right. Yes. This should be better. This should be better. Okay, so Bladder Smart, the Bladder Smart Low Acid Vitamin. So let me tell you the history of low acid vitamins, because this is something I am proud of. So about 15 years ago, I was talking with the CEO of a company named Far Laboratories. Back then, they made a supplement called Cysta-Q. This was before we had all the other supplements. And he said, Jill, if you could make anything for an IC patient, what would you make? And I went, I know exactly what I'd make. I'd make a low acid vitamin. And he said, why? And I said, because every day I get questions, is there a bladder friendly multi? And of course, the answer was no, because most of the big brands of multivitamins use ascorbic acid, vitamin C derived from citrus, and it's acidic. And vitamin flares are legendary. I had a couple of wicked vitamin flares after Centrums and One-A-Days. And he goes, interesting. Well, that's a very interesting idea. And then our conversation went on. 6 weeks later, he called me back and he goes, we've made your vitamin. And so that first low acid vitamin was called Multi-Right. And it was a great vitamin, but the pill was very big and hard to swallow. And that company has been went through bankruptcy. Actually, that was very recent. But anyway, the pill, it was a hard pill to swallow. It was a big, giant horse pill. So I came to Natural Approach Nutrition, the company that makes Peora, and I said, can you please make us a low acid vitamin that is easy to swallow? And they went, yes, we will. And that is Bladder Smart. And I'm very proud that the whole concept of a low acid vitamin was originally mine. Unfortunately, I didn't trademark it because now other companies are basically doing the same thing from something that was originally my idea. So anyway, the low acid vitamin that I personally take is Bladder Smart. You can find it in the IC Network shop. I'm really, really proud of the formula. I'm very, very proud of the company that makes it. I have very high confidence that we've got the best ingredients, nothing cheap from China, et cetera, et cetera. Guys, just a quick moment about international shipping. We continue to face really significant barriers shipping. We can ship to Canada, we can ship to Australia, we can ship to New Zealand. We cannot ship to the United Kingdom, and we cannot ship to the European Union. And we were shipping to Israel, but Israel went through some really big problems with mail delivery, and more than half of the orders were lost. So what I am doing is I am making separate web pages. So I already have it built. I have a web page already built for my UK customers, where I'm going to your Amazon store and I'm finding the best products that match the products that I talk about, so that you can get them in your country and not have to worry about customs and all that sort of stuff. And what I'm finding is some of the products that we sell are actually already in your country, like Pre-Leaf, like Dandy Blend. And so more of that's going to come, and I'm going to try that. I'm going to do one for Europe. I'm going to do one for the Middle East. I'm going to do one for Africa. Maybe we'll see. We don't have a lot of customers from Africa, even though I talk to patients in Africa fairly regularly, but it's much harder. So anyway, just know I'm working on that. Chloe says, when do I think the UTI vaccine will be in the state? God, I hope it's in the next year or two. I really hope so. It's very, very exciting to have a UTI vaccine. See, I asked C's in Scotland what's causing her flare. She said, quite sure it's stress, goes directly to the bladder and urethra. Oh, and you had an NAH referral 3 years ago, and you're just being seen now. Girl, you had to wait 3 years for a referral? What? Wow. Wow. Okay, that just shows how important our education in these meetings are. Can you imagine having bladder pain and not being able to see a urologist for 3 years? Like, I just wanna, like, go spend a year in Scotland and help create a new nonprofit there, and then go spend a year in France and set up a nonprofit there. Oh, there already is an IT nonprofit there, I take that back. Um, and just travel the world and try to set up IC clinics and pelvic pain clinics and educate others. I once wanted to have a bus early on. This was like 20 years ago. You just have the IC bus and just get on the bus and go have meetings in every state. Sue just had her inner stem removed on Thursday. Girl, how did that go? Well done. Well done. Ursula said, what's the difference between Cystro Protect and PEA 500? They're not, you can't even compare them. There's nothing similar about the ingredients at all. So PEA calms nerves down. Cystro Protect contains chondroitin for the bladder wall. Quercetin is an antihistamine in an olive oil base. And so Cystro Protect for the bladder wall to try to coat the bladder wall. PEA is to calm nerves down. You can take both at the same time, or you can take Bladder Builder, which has all the ingredients in one, and it would save you the money and you wouldn't have to buy 2 supplements. See, thank you for 99 stars. I really appreciate that. Guys, if you like these meetings and you like what we do, come on over to the IC Network and you can become a member or join our free newsletter list. That would be great. And we have a store and we have all sorts of stuff. We also have a really big area of free downloads. I have a free download pelvic floor relaxation exercise kit. It's just 2 pages. Sue says she hopes everybody weathered the tornadoes on the East Coast yesterday. Yeah. I was reading, I follow a couple of weather guys. Yeah, this is crazy, right? Because like a week ago, they're going massive rain, massive storms sweeping across the United States, which of course they have been. And they were saying that we were going to have the kind of El Nino driven just storm after storm after storm. And then everything changed. And now the weather storm shows very high temperatures across the United States. And it's like, where did that come from? I mean, like literally coast to coast dark red heat. And that's like, okay, either their computer algorithm completely malfunctioned or we're in for some weather strangeness in the coming week. Crazy. Denise says, I've been on estradiol for 2 years, but it irritates me so bad. My doctor called in a compound at the women's pharmacy. They were so nice. It's on the way. And I hope that it helps. Thank you for giving us all this advice. Good, Denise, good luck, hon. Good luck. I really hope it does. Sue says, I take magnesium, 2 of them at night for spasms. So they are so hard to swallow because they are huge. They do taste terrible, but they help. I just started taking magnesium too for muscle tension. And you know what, Sue? They're actually, they look big, but I can crush them with my teeth and I can swallow them that way. So they're not, the magnesium that I take is not a hard pill. I can actually just bite it up and swallow it in small pieces. Lori was just diagnosed with COVID. Do I have to worry if I have an IC bladder? It is a well-known fact that 75% of IC patients actually flare when they get COVID. And about 25% get really wicked flares. But that seems to be kind of calming down. I think now that more people are vaccinated and we've got better defenses, so to speak. Um, so I would just do everything you can to protect your bladder. Not the time to be drinking a lot of coffee or anything like that. You're just going to have to do everything you can to make this a very quick bout of COVID if you can. Isolate, stay at home, et cetera, et cetera. David said, is the IC network involved with the Ironwood pharmaceutical company? Absolutely, David. I've been working with them for almost a year now. Lama says, I have very difficult to pee. I feel very pain at the left side of my vagina before I do pee. What can I do? Honey, it sounds like the very first thing I would be thinking is that you've got tight pelvic floor muscles. And, I mean, your pelvic floor muscles are skeletal muscles. They help you move your body. But what makes them very, very unique is that they're the only skeletal muscles that also directly influence important bodily functions because they happen to have holes in them, a hole for the urethra, a hole for the vagina, and a hole for the rectum. And so say hello to your pelvis. If we look from the top down, you can see your skeletal muscles down there. You can see that they're flat. They sit along the bone. If we look at them from the bottom up, bam, 3 layers of muscles. And here's the outer layer right here. Okay. So you can see these muscles literally going around all of your urethra, all of your vagina, and all of your rectum. So if these muscles are tight, you betcha it's going to be hard to pee, and it's going to be hard to have sex, and it's going to be hard to have a bowel movement. That simple. So we want to make sure that your muscles are nice and calm. Have you been to physical therapy yet? Have you had a pelvic floor physical therapist? A therapy visit? Heat to relax those muscles. Maybe a muscle relaxant like Flexeril might help, but we got to get somebody to look at your muscles and see what's going on there on that side, on your left side. Kayleen said, I'd bitch up a storm if I knew I would advocate. You betcha. We're tough. Hey man, you have made it this far with IC. Don't ever think you're weak. You are tough. And you need to be proud of yourself. Think of everything you've done, even though you've been in pain. I know your family doesn't see how hard you're working. Your friends don't see how hard you're working, but you know how hard you're working. And you deserve a reward. You need to be nice to yourself. You need to be gentle to yourself. You need to have a cinnamon roll every now and then if that makes you feel good. Or take a hot, warm bath, read a good book, relax, rest. Laura, getting back to COVID right now, I don't know if you guys are following COVID trends, but we have a new, I know we're all freaking sick of it. We want it to be gone. It will never be gone. It is now something we have to deal with. It is like influenza. COVID is here to stay. And it will mutate and adapt over time. And each mutation is slightly different. Some of them are less infectious. Some of them are more infectious. Unfortunately, we have a new one now that's sweeping the world that is much more infectious. We're seeing ICU visits. ICU admissions are up 30% in different parts of the world. So if you're sick and you have a sore throat, please don't go to your grandparents' house. If And if you're weak and immune compromised, as I have a family member who is, um, they need to call whoever they would be going to and ask if people are well or not. And if people are not well, if we've got people who are coughing, they don't feel good for one reason or another. I mean, guys, we're just going to have to buckle down and protect our family again. It's okay. There's nothing more noble than protecting your family. Nothing more noble than that. Sue says, glad to have her interstim out. The deciding factor was after falling on it. Several times my legs still shook, but have had it off and on for the last, oh wait, hold on. For the last 4 years. Unfortunately, the 2-week trial, when your pain is fluctuating, it's really hard to tell the effect of this device, and um, Botox seems to be the biggest help. Do you want to get with you to order PEA? I have PEA. We just got a new shipment of it. So, guys, listen, for anybody who remember, you got to prepare. We're going to be, you've got one more support group meeting for me this month, next week. And because Christmas Eve and New Year's Eve are on Sundays, I will not be doing support group meetings those days unless people are sick and I'm stuck at home and I go, what the hell? Let's just do a support group meeting. So if there's anything you need from the IC network in our shop, please order it this week so we can try to get it to you. Okay. Sue says, I follow horse breeders in Kentucky. My thoughts were with him yesterday, but they also had a hobby farm. Very stressful for animal owners too. Yeah. Somebody just had a dog die of COVID, a puppy. It's crazy. Sue says, magnesium glycinate is the one you want for spasming. That's what I take. Nancy just got the results back from a urine culture, 10,000 to 50,000 mixed flora, and was told, is that normal? Is that true? Probably, honey. Listen, urine is not sterile. Urine is not sterile. There are lots of bacteria that are supposed to be in your urinary tract. And now that we have something called next generation DNA urine testing, they have been able to identify what we call the urinary biome to see what's supposed to be there. Listen, we would not be alive if we did not have beneficial bacteria. Beneficial bacteria do perform very, very critical functions in the human body. They help to digest food in the gut. They produce food to nourish the cells lining the gut. And we're just starting to learn now about the beneficial biome in the urinary tract. We know that it's different depending upon where you take samples from. So the biome in the ureters might be different than the biome in the bladder, which might be different than the biome in the urethra, which is going to be very different than the biome in the vagina and the rectum, et cetera, et cetera. So mixed flora doesn't come as a surprise, but it would be nice to know what they found. If it's generally lactobacillus, you're pretty good. But if you have, say, 50,000 E. coli, that could be a sign that you've got an infection that's starting to build. So I don't like generic results like mixed flora, everything's normal. I personally would like a little bit more specificity, especially if you're actively symptomatic. And this is where next generation DNA urine testing shines, because next generation DNA urine testing doesn't try to grow anything. Instead, it takes pieces of DNA and it will identify what's happening in your bladder based upon DNA. And it will tell you by species, good bacteria, bad bacteria, and fungus. And so if you have any doubts, Nancy, you can ask for a next generation DNA urine test. Sue says, all of the above plus recovering from surgery, I'm just going to give myself a break and tell myself it's okay to be sad and let it be okay. that everything doesn't have to be perfect. So that's exactly how I started this meeting off. You know, um, it's a difficult time. I mean, the holidays are difficult anyway. Children love the holidays. They don't understand the work the holidays take, the financial stress of the holidays, the personal stress of the holidays, what it's like to grieve during the holidays when you've lost somebody. And so for those of us who are feeling the stress of the holidays and the stress and the sadness of the world, we have to kind of buckle down and go, okay, listen, I mean, the past is over, the future has not happened. What we have control of is today. What can we do at this very moment to make our life better and to make the lives of our families and members and friends better? We can spend months or years worrying about the future, but it will never be a productive worry. You just get lost in the sadness. And so instead, ask yourself, what can I do right now that would make me feel good or would make somebody that I care for feel good? And if it's going to, like, I'm going to make a chicken and rice casserole for dinner tonight. Mild, gentle, good on my stomach. Okay, that's good. I'm going to make cookies for my family members and friends this week. It just, I want you to be not overwhelmed by world events right now. We can't change those world events. But what we can do is give love and kindness to the people around us. And that's ultimately the spirit of the holidays, I would hope anyway. Margie said, I do have a question on YouTube. So Margie's on YouTube. Guys, we're simulcasting right now. When I'm looking here, I'm looking at Facebook. When I'm looking over here, I'm looking at YouTube. Okay? Even though YouTube is right there because your camera is on the other computer, I still have to look over here. So Margie says, I do have a question. I have pelvic floor and some says no warm baths will cause a UTI and some says a warm bath is good for the tummy. What do you say? I love warm baths. I love warm baths. Back when I had terrible vulvodynia in high school, which of course we now know was caused by a tailbone injury and very tight muscles. Back then I didn't know that. But what I did know back then is that when I came home from school, I would soak in a really hot bathtub and I always felt better. And now I know why, because that hot bath relaxed muscles. I will tell you that I have not had a bath in about 20 years because I was caring for my elderly parents. The bathtub was in their bathroom and I was dealing with poop in the bathtub all the time. Let me tell you, elder care is not for the faint of heart. I did more enemas. I did more cleaning. No regrets. I love them. But I'm meticulous about cleaning a bathtub if I'm going to use it. And so I do intend to use that bathtub again, but I know what's been in that bathtub and I have to figure out what can I do to kill. I mean, it's clean. I've already cleaned it and scrubbed it a few times, but I'm not ready to sit on it yet. Maybe pure bleach? No, that would be bad. I've already done Lysol a couple of times. I have to think about it because that's a good idea. Let's see here. Patricia says, thank you for all you do, Jill. You're welcome. You guys are the reason I'm alive today, to be quite honest. Dana said, do you recommend next generation urine testing to get more accurate? Absolutely, I do. Is this just for the bladder or does it cover the vaginal biome? Listen, they do next generation DNA urine testing for vaginal samples. I've had that done for vaginal swabs. They can do it with the gut. They can do it with joints. They can do it in the jaw. They can do it in surgical wounds. Next generation testing is absolutely the future of testing. And if you go over to bladderhealth.org, that's a website that I built on next generation testing a couple of years ago. And I support it 100%. It's data. It's data. I don't like guessing. I like facts. Next generation testing is good, hard data. And in fact, okay, what was I doing? Like, I literally was doing, here, hold on. I have a really interesting case study. All right, where did I put it? Oh, I know where it is. Did I put it there? Oh, yeah. I know where it is. Hold on. Hold on. I'm going to be sending out this week a blast email on next generation testing. Oh, come on. Don't you just hate two-factor authorization? Two-factor authentication. It's like so annoying. All right, so here you go. This is a real world case study of where next generation helped. Consider the case of an 82-year-old woman with recurring UTI, which is 3 or more a year, who went to her doctor with severe frequency, nighttime urination, pain, chills, and a low-grade fever. She was not responding to the broad-spectrum antibiotics prescribed. Next generation DNA urine testing found not only E. coli, which was 48%, but also Bacteriicides fragilis, 50%, a bacteria that is common in diseases which cause diarrhea. Next-gen testing also revealed that she had multiple drug resistances. Given this information, targeted therapy with clindamycin, which is 300 milligrams twice a day for 14 days, was suggested. The patient was finally symptom-free at the end of a 2-week treatment. So it is also an undeniable fact that next-generation DNA urine testing can find and identify infections that urine cultures miss. And, the hard reality here is that a lot of you really believe you have infection. Even if your cultures come back negative and you have a healthy bladder wall, you still think it's infection. How can it not be an infection, Jill, if I'm peeing every 10 minutes? How is it possible? It has to be an infection. And I had one patient a couple weeks ago who just flat out refused every other therapy, including physical therapy, even though they found very tight muscles. She's like, no, I don't want physical therapy. I'm peeing all the time. I want you to do something for my bladder. I have an infection. Give me an antibiotic. And her doctor said, no, I'm not giving you antibiotics anymore. We are not finding infection. And she was pissed off and she called me. What do I do? And what I said to her is, I said, well, then prove it. Have a next generation DNA urine test. And if that urine test comes back with something funky, you got all the evidence you need to get the antibiotics. But if that test comes back negative, then you're going to have to walk away from your theory that you have an infection. And let's go where the data points us. The data points us to your tight pelvic floor muscles. So we have to do something about that. David says, is PCR and next generation DNA testing the same thing? No. PCR testing is like the first half of next gen testing, where they only look for the 20 or 30 most common pathogens. So it is not inclusive of all of the potential pathogens. It's a quick snapshot of the most common ones. So you get your PCR test first, and then a couple of days later, you get your full next gen test results. Why is my office so cold? This is crazy. I can't turn on my heater. I cannot turn on my heater because it would make a noise. Oh. Let me see if I can. That'll be better. Yeah. Okay. I bought this vest, I kid you not, like 30 or 35 years ago. I'm not a hoarder, but I might hoard clothes. I have about, maybe 15 plastic bins with my favorite clothes over the years in my garage. And I'm really glad I saved some of my favorite clothes because they don't go out of style. Peggy said, I have the next gen test, going to send it in tomorrow. I'm very interested to see what it shows. Yeah, it's going to be fascinating. Sue says there's some really good dog treat recipes online. If you use peanut butter, make sure it's the right kind. Okay. Sue said, I had my inner stim out on the day my dad died 3 hours ago. It's 3 years ago from COVID, right? They probably all thought I was crazy. I woke up bawling. Girl, honey, like I just wish that I could just reach through this screen and just give you the biggest hug I could possibly give to so many of you. Your life stories are powerful testimonies to strong and dignified spirits. All this time, everything you've gone through, Sue, and you're here today, you need to be so proud of yourself because I'm really proud of you. I'm proud of everything that you've done. You are a good, decent, kind woman. And I really treasure our friendship. And that I say that to all of you out there, Um, um, Dana and Peggy, Microgen has a combined test for both the vagina and the bladder. Kayleen said, my bath has been dealt with someone else's poop too, so I'll pass when anybody tells me to soak in a bathtub. It doesn't matter how clean it is. No, I'll get back in there eventually. I will. No doubt about it. I'm perfectly, it helps when you've studied microbiology. Poop doesn't scare me at all. I just, I want to be protective. Kayleen says, seems like my vulvodynia and bladder pain started with an untreated UTI. Well, okay, but the question is are you thinking that the infection then triggered the UTI, then triggered vulvodynia? Or is it that the infection was so painful, your muscles got tight, and then it's your tight muscles that caused your vulvodynia? That's more likely. You're very welcome, Sue. Virgil said, hey, from Manchester, England. Hello, Virgil. Nice to see you. I watch the Manchester airport live streams every now and then because we like to watch planes in my household. Irene, which of the supplements do you have in the IC Network store that would help with the fibromyalgia pain? PEA. There is a PEA fibromyalgia study that was pretty good. In fact, I can get it here. Hold on. Let me just grab it real quick and we can look at the results together. Hold on a sec. So I'm going to go to the National Library of Medicine, which is pubmed.gov, pub for publication. This is where you can find all the published research studies in all the medical journals. It's my second home. So we're going to go palmitoyl ethanolamide fibromyalgia, and let's see what the research said. All right. 1, 2, 3, 4, 5, 6, 7, 8, 9. All right, at least 9 studies. So let's do this first one, palmitoyl ethanolamide of fibromyalgia, results from prospective and retrospective observational studies. A total of 80 patients were recruited in 2 steps. The first was, okay, well, you don't need to know the detail, but I'll read it anyway. The first was a retrospective observational study comprising 45 patients. This patient group received duloxetine and pregabalin for 6 months. The second step was with 30 patients. With 35 patients, they also had micronized PEA from Italy. Positive tender points, pain evoked, pain intensity were evaluated at baseline at 3 to 6 months in both studies. The retrospective study showed that the duloxetine and pregabalin after 3 months of treatment showed a decrease in the positive trigger points, pain evoked, and pain intensity. In the prospective observational study with PEA introduction after 3 months provided a significant improvement in pain symptoms with a further reduction in the number of trigger points and a significant reduction in pain. Conclusion, our study confirms the efficacy of DLX and PGB and demonstrates as well the added benefit and safety of PEA in the treatment of pain in patients with fibromyalgia. Okay, and here is one from last June. Oh wait, they didn't, it's only the title. And here is another study of 407 patients. This was published in 2019. The results of PEA treatment represent an important step in the development of a new and well-tolerated therapy for fibromyalgia syndrome, mostly suitable for those patients who need long-term treatments. They've studied it with spinal cord injury. Let's just look at that one real quick. PEA was not found to be helpful for spasticity, insomnia, or psychological functioning. Okay, interesting that they would even go there. Strange. Anyway, so PEA, there's 2 forms of PEA. There's micronized and regular. So PEA does not dissolve in water, and it's a fairly chunky molecule. And so how do we deliver it in a size that is the most effective for absorption? And so there are companies who say micronized is the right way to go, and there are other companies who say non-micronized is the way to go. The research basically shows not very much difference between the two. Hold on a sec. Yamo says, I have very pain in my pelvic floor area when I sit for a long time. This pain comes in late at night too, around 1 a.m. Or is it muscle or nerve problem? Probably both, honey. It's probably pudendal neuralgia. Muscles so tight they're squeezing nerves. If you have pain when you sit down that gets better when you stand up, then that's going to be a neuromuscular origin for your pain, and it's going to be a combination of muscles and nerves most likely. David says there are a lot of choices on the next gen site. Which one should we be selecting? Hold on, and I can get the name for you because they just changed the names. Let's see. EuroKey. It's called EuroKey, Urologic UTI Test Service. And then for women, there's a Women's Key Complete, which will test urine and a vaginal swab, or you can get a vaginal swab. There's a prostate test, there's a rectal swab, a sinus test, a COVID-19 test, pulmonary, a wound, GI, STI, sexually transmitted diseases. There's a candida test, HPV for human papillomavirus, oral HPV, syphilis, dental work, etc. You're going to be in the EuroKey, the Men's Key Complete, most likely the EuroKey, or for women, the Women Key or the plain UTI one. Oh, you know, getting old sucks. I get muscle aches. Like if I sit at my dining room table and I read my iPad, but if I have put my iPad on the table and I'm doing this, which I did before I started this meeting, I just tweaked the muscles in my back. I might have to go get a heating pad. Oh, let's see if I have one. Here, hold on. Oh, I have one right here. Okay. Let me tell you, you want to find a great Christmas gift for anybody in your family who struggles with muscle pain, the Body Heat heating pad. You can get it's 3 for $4. We have never raised the price of these in 25 years. The company is so nice. So I have days where I will wear 3 of these. And usually I put them, okay, so I'm going to show you how to do it. So you can see it's completely flat. So if you're traveling, you're in a car going to grandma's house for Christmas, you can put this right over your underwear. You can just put it right there, right? And nobody will know it's there, and it will deliver heat for hours. So the way you activate it is you peel off the back, and it's going to take about 30 minutes for it to get warm, and it can get hot too. So I'm going to put this between my shoulder blades. That's where. Ah. Yama said, is PEA good for me because I have a bladder infection? It's not going to do anything for the infection, honey. It might help reduce some pain, but it's not a treatment for infection. If you have infection, the right treatment is an antibiotic. They've got to identify the infection and then identify the correct antibiotic for that. Helene, hello, Helene. Could PEA also be good for unspecified lower body nerve pain? Absolutely. I take 300 milligrams GABA, but I still have spillover lower back and lower belly pain from bulging nerves and scoliosis. Girl, you are my twin. I've got bulging discs and I also have scoliosis. And so I have an S curve, right? So I have a little S curve. And so the muscles on the outside of the curve get stretched and the muscles on the inside get contracted. I've always said if there's one thing I could change about my body, it would be scoliosis. I hate having it. And yet Usain Bolt, the fastest runner in the world, he's got terrible scoliosis. You can look at his back and you can see it, and yet he's, amazing. Okay, hold on a sec. Bladderhealth.org. Bladderhealth.org for the Next Generation website. Sue said, I was misdiagnosed for 35 years. Fear never stopped me, but also I should have had a little bit more fear. Always got a second opinion. Do your research. I'm 80% better now. Yes. Than I've been now that I've been correctly diagnosed. When I was first diagnosed, I was told it was an incurable and that was going to have no quality of life. I survived one treatment and drug trial after another to my bladder, and it was never my bladder. You guys are so lucky if you're newly diagnosed. The science has finally caught up with the condition, even though it's going to be a struggle. Sue and I are very similar. It was never our bladders. It was always been muscle and nerve. Virgil says we love the American accent. Okay. Sue said, I'm going to disagree with you, Jill. The internal work is very important. If I didn't have a lot of other work, like to strengthen my left hip, my balance, my feet. You're absolutely right, honey. All of these things were very important for stabilizing my pelvic floor, plus the internal work. But the right pelvic floor therapist is critical. Yes, completely agree with you, Sue. Kayleen said, something went wrong. I did get ischemic colitis at the same time. At 24, I thought my body was like an indestructible teenager. Bad food caused constipation and diarrhea. Then a UTI popped up. Absolutely no one prescribed antibiotics and a double kidney infection. I was told to take NSAIDs for the pain, admitted to the hospital for ischemic colitis. I remember when I got out, I saw a urogynecologist and the exam was so painful. So something happened with the muscles and nerve. Yeah. Well, when you're in pain, your muscles and nerves get tight. And when you're injured, nerves become inflamed. So definitely. Sue says, I'm a direct descendant of Mary Queen of Scots on my dad's side. How cool is it that how cool is that, even though she had an unfortunate end? And Sue, we have on both sides of my family, let's see, one of my relatives in Norway traced back my grandmother's ancestry like 10 generations ago to like the King of Norway or Eric the Red, or I don't know. Anyway, hey man, in the end, we're all related to each other anyway. She said, when I started pelvic floor therapy and hip therapy, my left leg was almost an inch higher. Now it is almost parallel to the other, which has greatly improved my spasms and my pain in my bladder. Sue, isn't that amazing? We got to write that up. Virgil said, awesome greetings from Manchester, England. The guy on my right, as you look at it, is Tommy Gallagher, Liam Gallagher's dad from Manchester band Oasis. I've known him all my life, my best friend. He's 81 now. You can easily Google him or join my Facebook page. Cool. Denise said, will the doctor willingly give you the script for the next generation testing? I feel they wouldn't know what it is. Some do and some don't. It's tricky. Sue says, I love my weighted heating pad. You know, Some people absolutely love their weighted blankets and stuff like that. Carolyn said, I wasted 6 weeks on pelvic floor physical therapy. The lady always left me on my own while she was on her phone or laptop. I still dribble when I cough and sneeze. It's sad. Yeah, it means that you just got to up your game and find somebody better, hun. There's a fabulous website, pelvicrehab.com. Pelvicrehab.com will help you find a truly qualified physical therapist. Lama said, is aloe vera good for the IC patient? Aloe can be soothing. So if you're in a flare, if you're having a bladder wall flare, aloe has the potential of being soothing to the bladder. But you have to remember that the bladder is not made of aloe. It is a plant material. And so it doesn't have what I call a constructive effect. It doesn't build. Whereas a supplement that contains chondroitin is, in my opinion, a more viable option, especially for long-term use. Using aloe vera long-term, now that I kind of know the science a little bit more, using aloe long-term just doesn't make a lot of sense to me personally. I mean, yes, it might be comforting and soothing, but that's what I call chasing the symptoms. We have to try to focus on finding and identifying underlying causation. So if you have a Hunner's lesion, we got to get the lesions treated correctly. If you've got estrogen atrophy, aloe is going to do nothing for estrogen atrophy. Estrogen is going to be far more helpful in getting this skin to be healthier and thicker with a nice, producing a thicker mucosal barrier in the bladder that will protect the bladder wall. And so the only value I see with aloe now is really for patients who are struggling with a flare. But again, it's not making as much sense to me now that we've got, these new supplements, especially the chondroitin-based supplements and the PEA-based supplements. Don says, hi, Jill. I heard you mention a couple weeks ago you helped somebody with pelvic congestion syndrome. Well, I got my CT scan and it says prominent left adnexal vasculature. Well, who knew? This is great. This is great. I mean, I'm really, really glad that you had that CAT scan. And now we have a much clearer idea of what could be causing your pelvic pain. So your next step is going to be with an interventional radiologist so that you can get it treated. And it's equivalent, it's a varicose vein. It just happens to be a very large varicose vein in the pelvis as compared to the smaller ones that we often get in our skin. But if we can reduce and limit that, what's the right word for it? What it's the right word for it? Blood pooling. There's a word there. It'll come to me eventually. If we can reduce that, so blood does not pool and collect in that vein all day. The problem with pelvic congestion syndrome is that blood pools over time every day. And so as the day goes on, you get heavier and heavier and heavier and heavier until for some patients by the end of the day, they feel like they have a bowling ball in their pelvis and walking hurts. But then you go to bed and because you're flat, all the blood moves away and it's no longer pooling. And then when you wake up in the morning, it slowly but steadily starts to pool again, which is why that symptoms get worse and worse and worse and worse. And it's very confusing for the patient because it's like, well, it doesn't hurt at night. It only hurts at the end of the day. And we're learning a lot more now about the role of arteries and veins potentially causing problems. Dom says, I owe you. Well, you don't owe me anything, honey. It's definitely underdiagnosed, and I had to push my gynecologist for a referral, so everyone be aware. I'm so excited for you. I'm so excited for you. It's just so important to go beyond those moments of you have an incurable disease to, because we don't think of IC as a bladder disease anymore. We don't. It's a neuromuscular disorder, and that's what our national guidelines say. Our national guidelines say that in the vast majority of IC patients, there's no disease process happening in the bladder at all. Further research studies show us that the far more common subtype in the IC patient population is pelvic floor driven. 80%, 85% of IC patients have muscle problems. But, there are always going to be patients who don't fit. And pelvic congestion syndrome is the perfect example of somebody who has long term persistent painful symptoms for which bladder therapies haven't helped, for which pelvic floor therapies haven't helped. And again, what do our guidelines say? If you're not responding to therapy, you're getting worse rather than better, stop, take a step back, revisit the diagnosis. What did we miss? What did we miss? David said, will chondroitin help the Hunner's lesions? I don't believe so. There was a research study presented at the European Society for the Study of IC meeting a couple of years ago, which said that the most important ingredient in a bladder installation is chondroitin, because chondroitin plays a critical role in the, quote, superficial integrity of the bladder wall. In general, Hunner's lesions do not have favorable results with bladder installations. And now we know why, because we have found virus in the urine of patients with Hunner's lesions, Epstein-Barr polyoma virus. And if that's the case, then we need to be doing more antiviral therapies. And we had our first research study presented again at the European Society for the Study of IC meeting last June or July. And it was the first study that of Hunner's lesion patients where they did the next gen test, they identified virus, and then they used an antiviral medication. And that's the first study I'm aware of that's done that. And by the end of the treatment with antiviral, no virus was found in these Hunner's lesion patients. The virus was suppressed. Of course, the challenge is once you have a virus, it's usually there's still always a little bit of virus in you, aka chickenpox and shingles. I mean, we've all had chickenpox. I had chickenpox and measles at exactly the same time in Bakersfield, California. I had both. I was sick as a dog in kindergarten with that. It's crazy. A. Helene says, Jill is a godsend. She advised me to ask my physical therapy to check to see if I had tailbone issues. And guess what? It's fractured, which led to x-rays, which led to finding out about my scoliosis and lumbar MRI. Girl, I mean, I wish that we could go back in time 30 years ago and in all those early studies where they were doing kind of epidemiology and prevalence of IC, I wish that we could have had the benefit of hindsight and asked, did you break your tailbone? Did you have any falls? So many patients have fallen downstairs butt first and broken their tailbone. Or, oh God, I was worried. Who was I? Okay. I was working with a gentleman this week who was a very, very prolific dirt biker. and was like professionally competitive for a period of time. And his pelvic floor was messed up. I also worked a couple of years ago with an X Games competitor, skateboarding, who had fallen on his tailbone multiple times and was having all these symptoms. David said, "Would lysine help with Hunner's lesions?" I think lysine is a no-brainer. Um, to certainly consider adding to your daily routine. Lysine is an amino acid which has been found to interfere with viral replication. So, for anybody who's had COVID or struggling with COVID, throwing in a little bit of lysine every day just makes sense. For those of us who get canker sores and cold sores, we buy super lysine chapstick, which cuts down the viral infection by about half. At least it does for me. I got the worst cold sore of my life the week after my parents died. And you guys didn't see me. It was this ginormous cold sore like over here. And all I can say is thank God for lysine. Oh, so, given our knowledge of Hunner's lesions often being connected to viral infection, having a little bit of lysine on board makes sense. Whenever I have a cold sore or a canker sore, I always add lysine. I've been doing that since my 20s, 40 years. Helene said, "I'm now working with a trainer to help build better posture after 8 months of pelvic floor physical therapy, so I can relieve some of the pressure on my pelvic floor. My IC is definitely muscle and nerve driven, as I can eat anything I want." Yeah, I'm the same way now. I'm the same way. David says, "Thank you." You're welcome, David. You're very, very welcome. Lama says, 2016, I've done urodynamics. Doctor said I have a hypocapacitive, hypersensitive, and normal active bladder. No evidence of bladder tumor, Hunner's lesion. Hypocapacitive? I gotta look that up. Hypo. Hold on. I'm assuming your spell checker probably. That's not even a word associated with the bladder. No, I think your spell checker got you there. A hypersensitive bladder, that makes sense. That's part of IC subtype 5, central sensitization. And a normoactive bladder? Assuming that that would mean a normal functional bladder. A urodynamics test tests the nerves to see if the nerves are behaving normally. You know what they do is so a urodynamics test is not specific to IC, but it is used to make a diagnosis of overactive bladder. I had it done. It's not the funnest thing in the world, but it's not terrible. Basically, you do it in the doctor's office. You're up in stirrups. They slowly fill your bladder through a catheter with fluid, and then they start asking you questions like, "Tell me when you first feel the need to urinate." And so you're waiting, you're laying there waiting as they're filling it up. And then finally you go, I feel something. And then finally it's like, okay, I can pee right now. And then they go, okay, hold that. We're going to now just tell us when you first feel pain. And you're like going, okay, I really need to pee right now. I really need to pee right now. Okay, it hurts. Stop. Stop. And then sometime, at least my doctor, my beloved Dr. Klein, he's like, "Okay, just hold on." And he just pushed it a little tiny bit more, and he's like, "Okay, I'm done." And he emptied out my bladder. I was like, thank God. There's another test called a voiding cystogram. A voiding cystogram helps you determine if you have your ureteral reflux. So what that means is that if you have urine in your bladder that flows backwards up your ureters towards your kidneys. And sometime in the last month or two, I actually was working with a patient who had that, which is really interesting. So what they do with that is you're in the x-ray department and they fill your bladder with fluid, and then okay, it was like one of the worst experiences of my life. And I got the radiologist fired. I did, and she deserved it. So I had a letter from my urologist, and the letter from my urologist said, because I had to have the test to get into a clinical trial. Okay, so I was willing to do it. So I have this letter that I bring into radiology from my urologist saying only fill her bladder to 400 cc's or something like that. And the urologist refused to read it and said, "Don't tell me how to do my test." And then she brings over the IV pole with a full bag, 1,000 cc's of saline solution. And I look at that and I'm looking at her going, "Huh? Please read the letter." And she said, "I got this. You're fine." And I wanted to get into this clinical trial. They don't do this now in clinical trials. This was 30 years ago. So let's say they take an x-ray first because you're laying flat on an x-ray table. Then they start filling your bladder with fluid. And then when your bladder is full, they want you to pee and they take a picture of you urinating while you're laying on an x-ray table. Now, I don't know about you, but I cannot pee flat on my back. I cannot do it. My body is trained to pee sitting on a toilet or standing on a toilet. I mean, or standing next to a toilet, or you know what I mean. And so she's like, "Okay, pee now, pee now." I'm going, "I can't. I can't. I can't. I cannot do it." She goes, "Just pee around the catheter." What the? How do you pee around a catheter? How do you pee around a catheter? And all this time, she's filling my bladder with fluid. And I looked up 800 and I started screaming in pain. I was hysterical. The pain. She gave me a hydrodistension without anesthesia. And finally, I screamed so loudly, other doctors came walking in, and she was forced to stop and pull it out. And I was allowed to get up and go sit on the toilet and empty my bladder out because even if my bladder was overly full, I could not empty my bladder flat on my back. I just couldn't do it. And Sue says, "I also cannot. I tried to do that test too. I couldn't do it." She stopped the test. I did not have that unfortunate experience. And this was at Kaiser Permanente here in Santa Rosa, again in 1993, June of 1993. It is forever etched in my memory. And they sent me an evaluation form and I nailed them. I called it the single most, I don't remember, shattering medical procedure of my life. And a week later, I had a call from the chief of the radiology department with a profuse apology, and that girl got herself fired for ignoring the instructions of another doctor. No regret, she deserved it. All right, 2016, I've done urodynamics. Doctor said I have the hypersensitive bladder. 2017, I had a transurethral resection of the bladder wall. Why? Why did they do that, Lomo? Did they do that to take out a Hunner's lesion? And you guys on YouTube, you're on a 3-second delay. Just so you know, you're on a 3-second delay. Donna said that's like torture. It was. A. Helene said, I knew it was already said, but I must have missed it. Are baths bad for UTIs? I just took one and now I'm worried. No, as long as you get up and urinate right afterwards, I really don't see baths being that bad unless you're not cleaning your bathtub. When I was taking a lot of baths, let me tell you know, I always scrubbed once or twice the bathtub before I went in because I never knew who was standing in the bathtub because there's a shower in there and what else happened in there. Sue said, I'm surprised it didn't explode your bladder. It's a miracle it didn't, hun. It's a miracle it didn't. But in hindsight, it proved that, let's see, knowing that my bladder this entire time was healthy, should it have hurt that much? Well, my muscles were very, very tight. An interesting question. Could we have gathered useful information from that? I don't know. I don't know. That's fascinating. Also, for those of you who do take baths, one of the things that you can do in your bath to really make it very soothing is use some baking soda, like a half a cup of baking soda in a tub of bath water. Very, very soothing. But please stay away from bath bombs, anything that smells good, anything that's fizzy. Do not do it. Your skin is likely sensitive down there. As a kid, I could never do bubble baths. It always burned me down there. But just plain baking soda. You cannot go wrong with plain baking soda. Or there's a product that was called, oh God, what was it called? It was like a big tea bag, and it's used for women who have had episiotomies. And we sold it. We haven't sold it in about 10 years, but God, it was good. What was that called? It might have been a Medicine Mama's product. Hmm. Anyway, we had a lot of people who used this herbal, is a tea bag in their bath water, and it had things like chamomile in it and stuff like that. And it was found to be very, very, very good. Let me see if I can. And then also a sitz bath, the colloidal oatmeal sitz bath. That was pretty good. This is going to bug me. Tea bag, bath water. Let me see if I can find it because, gosh, I had a couple patients who just absolutely loved it. Vaginal suit. Let's see. I'll try to find it. Bathtub. I will try to find it. It was really good. The reason why we stopped selling it is I got one shipment that had moths in it. But it only happened one time, and we sold it for like 20 years. It's really popular. Maybe the company went out of business. Hmm. Hmm. I'll see if I can find it. Yeah, but it's not regular tea. It was like an herbal tea. Sue says I can't have a bath for 6 weeks because of my surgery, but I never know about baking soda. Never knew about the baking soda. What about the Epsom salts? I do them. I don't, Epsom salts. See, salt can be irritating to a wound, so I'm not as I if I wouldn't want to do Epsom salt. I Back when I was doing it when my vulvodynia was so bad, I would never want to use a salt down there. So I was doing, I mean, a strong salt down there. I was going for the baking soda instead, which is a little salty. Helene said, I know it was already said, but I must have, oh, okay, we got that. Don't be worried. Don't be worried. So, does anybody have any, you know what I'd love to hear? What are some of your favorite icy friendly holiday treats or meals? Lama says, I have done this operation because of the infection on your bladder wall. They did a resection in your bladder because you had an infection in your bladder wall? Wow. That must have been a wicked infection. Did you have like a wound where they could actually see the infection in your bladder wall? Peggy said, what's a website to find pelvic floor therapist? Pelvicrehab.com, short for rehabilitation. Pelvicrehab.com. Sue said, I'm surprised a lot of us don't have infections in the bladder wall. So many of us can't tell when we have an infection. Well, if anything, Sue, what it says, the fact that so few of us actually do have infection shows that that nice thick coating of mucus in our bladder does a really good job of protecting that tissue. Because really the only people who struggle with recurring infections are going to be those who don't have a nice thick coating of mucus because of estrogen atrophy or being on Lupron or birth control, stuff like that. It's also fascinating to know that the vagina is one of the cleanest parts of the human body. You would think it would be one of the dirtiest. It's one of the cleanest because all of the skin sloughs off every couple of hours. The vagina has incredible self-cleaning capability. And I think that assumption might also apply to the bladder to a certain extent. Diane said, I have pelvic floor dysfunction that also caused me to become constipated. Is it common to have trouble with bowel movements and icy pain? Absolutely, honey. And I can show you exactly why. So this is the outermost muscles, or these are the muscles directly under the skin. And so here we have the urethra and we have the vagina and oh Betty, the rectum, and oh look at all these muscles right here. Look at all these muscles right here. If these muscles are tight, it's you have to remember that urination and defecation ultimately are about relaxation. Nerves send a signal, muscles relax, empty. But it's really hard when the nerve sends a signal that you're full, but your muscles are so tight you can't empty and you end up straining. And straining just reinforces that muscle tension. And so This is, let me see. Okay. So I have talked a lot about, um, I used to have, well, I still occasionally have pain sitting, but if I sit for a long period of time, I can get rectal pain every now and then. And when I was younger, I always thought that that was a hemorrhoid or something like that. And it wasn't until I had pelvic floor physical therapy and they started working on these muscles here that I started actually noticing or accepting, oh, that's a muscle symptom rather than a rectal hemorrhoid symptom. And so now, if I start getting rectal pain, what I do is imagine that this is a real butt and there's skin here. Is I will bring my hand kind of down my crack, right? And I'm not touching the muscle. I'm actually going to touch the muscle here and here, right? So I'm not putting any pressure on my rectum itself. I'm always working about an inch to the left and an inch to the right. And I'm telling you, 9 times out of 10, when I have rectal pain and I slide my finger down here and I touch these muscles, they're tender to touch. And that's how I know that that rectal pain is actually muscle pain. And I got to work on those muscles to get those muscles to release. It's fascinating. Lamo, I don't know what that means though, honey. I'm sorry. My doctor wrote hypocapacitive and normative Harnblath. It's in German. Sadly, I have no German expertise. I couldn't even count to 5 in German, I'm sorry to say. My brother could, I couldn't. Sue said, "I only had a few actual infections, but I know a lot of people who get them a lot. What about this new medication for bladder infections?" Well, it's the new vaccine. The new vaccines are awesome. They're performing very, very well. Tens of thousands of patients in many countries have now had it done. It's showing remarkable effectiveness. It's just we just don't have it here in the US. They've got to go through the whole FDA approval here in the US. It's going to change the face of urology. Imagine the money that's going to be saved. It's just absolutely amazing. Julie says, however, some people with IC find that certain foods or drinks trigger or worsen their symptoms. That's true. Preaching to the choir, girl. We I was very, very diet sensitive. Why? Because my muscles were so tight, I was in a state of ischemia. If your bladder is supposed to get 24 units of blood a day and it's only getting 10 because your muscles are so tight, are you going to have a healthy bladder wall? And the answer is no. Of course not. There's no way your bladder wall can be completely healthy if it doesn't get the oxygen and the nutrition it needs. That's why patients who have pelvic floor dysfunction become diet sensitive. Of course, somebody who has Hunner's lesions is also going to be diet sensitive. Somebody who's chemocystitis is also going to be diet sensitive. But the underlying cause is different. Sue said, not holding your breath when you have to go to the bathroom, no matter what it is, makes a huge difference in preventing pain after and protecting your pelvic floor. My physical therapist told me to always breathe slowly and deeply, and also never ever blow your nose while sitting on the toilet when you are in a vulnerable position. That's good. And Annie said, you do the same muscle massage that I do. Yeah, exactly. Christine says, mind telling how your physical therapy process went? How long did you see physical therapy for relief? Okay. Um, 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 um. So I had my first pelvic floor assessment when, like, in the early 2000s. Karen Kurtovich did it. And she found that my muscles were very tight. And when I did a Kegel around her finger, it was very easy to contract and it was a very hard to relax. So I did like 4 Kegels in a row. First Kegel was fine. Second Kegel was, by the fourth Kegel, I was barely able to relax those muscles. And she said, okay, you definitely have tight pelvic floor muscles here. Your muscles are tight because they're compensating for weakness. And what she found was that my piriformis muscle, my deeper muscles, were very, very weak. My levator muscles were very, very tight because they were trying to compensate for some of the work that the other ones should have done. But I did not do physical therapy with her. And I don't know why. I don't know. We didn't have the research yet. I mean, everybody was talking about it, but we didn't have data that showed how important it was. Um, After I had my hysterectomy, I had 10 months of pelvic floor spasms. And it felt like there was a hand up inside my vagina grabbing onto my fresh scar where my cervix used to be. It was a pulling sensation. Sometimes it was a pushing up sensation. Sometimes it was a pulling down sensation. And sometimes it felt like somebody was shoving a wide funnel up my urethra or up my vagina. Really weird. I mean, it's so hard to describe these symptoms. The symptoms are difficult to describe. When I finally got back to my gynecologist who kept saying, it's normal, he took one look and he gasped. And he went, "Oh my God, I can see your muscles quivering." And I'm like, "You think?" And I love him. He knows I love him. And he goes, "So we know how to fix this. You need to go to pelvic floor physical therapy." And I'm like, sign me up." And he goes, "Well, I need you to know that most women drop out." And I went, "I'm not like most women. Sign me up." And it's like, "Why?" And he goes, "Because it's really painful." And I'm like, "I don't care. Sign me up." And realizing I was recovering from a hysterectomy too. Now, I never found, oh, Annie, hold on to that for 1 second. That's cool. So I have never found physical therapy itself, that finger in my vagina, painful. I mean, occasionally I'd go, but it didn't trigger serious pain for me at all. And I was like going, okay, she's working with muscles. I could tell the muscles are tender, but I didn't scream or anything like that during physical therapy. I never have. I always felt it when I walked out of the office, and especially when I went and sat in my car. That act of going from standing to sitting, especially if you go boom, as I did the first time, huge mistake. So the first time I had physical therapy for this situation, I started crying as soon as I sat down. It was bad pain. It was bad pain. I drove home crying. I walked in crying. I grabbed a heating pad. I laid in my recliner for 8 hours and I did not move other than to pee. But I wasn't going to give up. I'd been warned. So I obviously I went back and I said, okay, listen, it was really painful. And she's like, okay, we got something to work with here. So then we did it again. And the second time she goes, well, it'll be interesting to see how you do the second time. So the second time again, I got up, started walking, went, uh-oh, okay, wasn't terrible until I sat in my car. And again, I started crying and I drove home. But it only hurt for about 3 hours. The third time, because I'm stubborn, I'm not abandoning it. I went back. It didn't hurt. When I walked out and sat in my car, it didn't hurt. And it hasn't hurt since then. And so there's always muscles respond beautifully to physical therapy. Guys, I did surgery when I got my pharmacology degree. And so I did surgery for a year as a surgeon. And it's a really rare degree. And what I'll never forget doing surgery is that I could make a little incision like this wide through muscle. And just by kind of doing this motion with forceps, I could stretch that little incision to this wide. And then it would go back in place. And muscles are amazing. They are incredibly responsive. And so, my muscles were basically doing this after that physical therapy. I mean, this is the best way to explain it. It's just doing this. And so she went in and got the muscle flattened, right? But as soon as I sat down in the car, they went like that again. And then the second time, they were probably, and this is not anatomically correct. This is the only way I can describe it. The second time, it was probably, but she got them flat again. The third time, she got them flat and they stayed flat. And that isn't exactly what a muscle looks like. That's just the best way I can try to explain it. So what Annie says here is really important here. Annie says, I have an electric shock on my feet and my pelvic floor like a drill into my urethra. So Annie, you have a pudendal neuralgia, hun. Anytime you've got that shocking sensation, the pins and needles, that is a muscle that's so tight, it's squeezing a nerve. And I want to show you some pictures here because I can explain that. And that's just that just came up with another patient that I was working with. Here it is. Perfect. Here's the perfect picture. Okay, so here, hold on a sec. Okay, so let's go back to our model here real quick. So we got your vertebrae, we got your sacrum. Your spinal cord comes down out of the vertebrae, and the nerves then pass through these 8 holes. Okay, so 4 nerves go on the left side, 4 nerves go on the right side. So if we look at it on the inside, these nerves are coming out of the spinal cord and directly into the pelvic cavity. Now, I want you to look at this picture right here. Okay, you see this right here? So here's the nerve coming out of your sacrum. This is an even better picture. Look at this. So here's your sacrum. So you can see that nerve, the 3 nerves or 4 nerves physically coming out. But with this blow up, do you see what's happening right here? These nerves pass through muscles. They pass through pelvic floor muscles. And then at the base, they connect and they become one nerve again because they have to pass through what's called the Alcock's canal. And then after it goes through the Alcock's canal, the nerves split up again to innervate your clitoris, your rectum, all that sort of stuff. Okay? So, honey, the reason why you have that shocking sensation is you have a nerve probably down below the Alcock's canal that is being squeezed by a tight muscle. So let's see here. So I get a in my it started in my 20s, and again, I had no clue I had muscle problems at all. No clue at all. And I remember I was reading a book on my couch and my feet started to tingle. My feet started to tingle. It was crazy. My feet were tingling. And it was kind of scary, but it went away after I had a bowel movement. Well, that happens now and then. And it happens either because I've moved my muscles in a certain way, because those nerves that come out of your sacrum do end up going down both legs. They will end up down innervating your feet. And in fact, when you have interstem or you have the ankle stimulation, and they turn that stimulation on, they look to see what your feet do, and they look to see if your big toe bends down, because that proves that they've hit the right nerve. So it's not at all surprising to me that you're having issues with your feet, that electric shocking sensation in your feet. Um, and that means a nerve is being compromised in your pelvis in some way. So, have you been to physical therapy? I mean, have they done a proper pelvic floor assessment? Because that's a very, very, very important symptom that they need to know about. Sue said, I had a spot she would touch me that would send me through the roof. I told my doctor exactly where that spot was before he gave me Botox. There is no pain there currently. Yes. Although it's just been a month, I don't know how long it will last. We'll see. Good. Well, so he silenced that nerve around that scar tissue. So that's good. Christina said, so through all of your pain from a young age until your hysterectomy, you didn't see physical therapy? No, no, I didn't. We didn't know about the role of the muscles back then. I had physical therapy for my scoliosis, never had any pelvic floor work at all. And so, I mean, I broke my tailbone at the age of 14. I had vulvodynia in my teens, severe vulvodynia in my teens. I couldn't sit through class. I had frequency urgency. Then I had IBS in my 20s and so forth. And nobody at that time was talking muscle. We were all going in incurable bladder disease or an incurable vulvar disease. That's the message we were all given back then. And so we didn't learn the role of pelvic floor physical therapy until 2008. I think either 2008 or 2011, where we had our first major study that proved that when you worked with these muscles, bladder symptoms went away. And interestingly, I mean, I was at the very first conference where Rhonda Cotterinos, a physical therapist, came to implore urologists to work on muscles. She said, guys, you keep describing muscles so tight, they're like tight piano strings, but you don't do anything about it. I'm a physical therapist. I'm working with these patients. And when we get these muscles relaxed, their symptoms improve. Would you consider this? And they laughed at her, laughed her out of the room. The second year, she came back and they gave her the last speaking point of the day. And half the doctors walked out before she even got started. Everybody laughed. No way is this muscle driven. No way, no way. Yeah, yeah, yeah. Now she teaches them. She's a hero in the IC movement. She's a hero in the pelvic pain movement. But she was able to convince the National Institutes of Health to do a pelvic floor research study, myofascial massage research study. And it was a multi-center study around the United States and in Canada. And the data absolutely proved that pelvic floor myofascial work was stunningly successful at reducing pain. And that is the moment that the IC world was turned on its head. Because up to that point, everybody's going bladder, 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 incurable, incurable, incurable. And then everybody went, oh, wait a second. If muscle therapy helps, maybe muscles are part of the problem. And now, if you look at our newly revised AUA guidelines for IC, they state at the very first appointment with a urologist, that urologist is supposed to check the pelvic floor, and if those muscles are tight, that patient is to be immediately referred to a pelvic floor physical therapist. The AUA guidelines only have two recommendations. I mean, they're like rules. Rule number one, if you find pelvic floor tension, get them to physical therapy immediately. Rule number two, if you suspect this patient has Hunner's lesions, look for Hunner's lesions. So, I mean, the IC world has been turned entirely on its head. And it's kind of a good news, bad news in a way. It's a great news because finally we can give treatments to patients that help. I mean, I'm symptom free now. My vulvodynia is gone, my IBS is gone, my IC is gone. I've had a hydrodistension, I have a perfectly normal bladder. There's nothing physically wrong with my bladder. It all relates to me breaking my tailbone when I was 14 years old and scoliosis. And that's the majority of patients out there by far. So, but the bad news is that, everybody's going interstitial cystitis. It must be a bladder disease. Interstitial cystitis. And that's why the great majority of the world is no longer using the name interstitial cystitis. This is called a bladder pain syndrome or urologic chronic pelvic pain syndrome or pelvic pain syndrome bladder primary, where the symptoms are manifested in the bladder, but it's often something outside of the bladder that's driving these symptoms. Dom says, I have periodic foot tingling as well. Neurologists couldn't find anything, so I'm sure it's coming from my pelvic floor. Undoubtedly. Helene says, my favorite icy friendly holiday meal is sauteed kale with baked sweet potatoes, baked chickpeas, candied walnuts, very sparingly, craisins, and a tahini dressing. That sounds wonderful. Um, Diane said, will both IC pain and constipation get better at the same time from treating the pelvic floor? It should, yes. It should. Dom says, Duke is working on the oral UTI vaccine. Outstanding. I want to buy stock in that company. Oh my God. Diane says, what do you think about research on the foam-based rectal pain medication? Do you think it can help IC because of a pelvic floor problem? How about helping IBS? It's going to help anything with pain. It has the potential of helping any pelvic condition that struggles with pain. I am really excited about this study. So it's one of the clinical trials. And so we've got 3 active clinical trials right now with IC. And one of those clinical trials is testing a new method of pain control by using a foam and they insert it rectally. Now, why is that important? Because the nerves merge. The nerves from the bladder and the nerves from the rectum merge at the spinal cord. And so, and we have something called neuro crosstalk where the nerves talk to each other. And so the theory is if we silence a nerve on this side and we silence a nerve down by the rectum and all the way up towards the spinal cord, that it will also turn off the pain nerve up here from the bladder side. And so I'm very, very, very excited about all the 3 clinical trials that we're working on right now. I think and we have that new one that we just kicked off last week with a new treatment, an oral medication. So we got some good things coming. And for those of you, so the advantage of a clinical trial is that it's free medical care with some of the best IC doctors in the country. You get, they monitor you you get free treatment, free monitoring, and you are giving the IC community the gift of your time, because this is how we figure out which medications work and which medications don't. So most of the clinical trials will have a placebo arm versus a treatment arm. And you don't know which you get. and the doctor doesn't know which you get. And you're going to do one or the other for 3 months, and then they reevaluate. And our goal here is to prove that the treatment is more successful than the placebo arm. The placebo arm means it's basically kind of like a sugar pill or something similar to that. In the pelvic floor physical therapy study, the placebo arm was just general massage uh, outside of the body, where the pelvic work was myofascial massage. So obviously, those patients knew which they got. But Diane, you can find, if you just go to the front page of the IC Network website, icnetwork.org, scroll down to the big cross area that talks about research and clinical trials, and you'll find all three right there. And they'll give you the name. The new one is called, hold on. The OAG 1050 study, OAG 1050. So that's the brand new one. And that's a new therapy, a new oral med. And then the foam study is from Ironwood. And they don't give the investigational name in this. In an effort to develop a safe, dedicated potential pain management option to relieve IC pain, Ironwood is conducting a phase 2 clinical trial of a novel rectally administered foam. The study drug is designed to utilize the shared nerve pathways between the colon and the bladder to modify pain signals in the colon, which might also relieve bladder pain associated with IC. They're looking for 300 patients. You can do it up to 21 weeks. And I have all of the clinical trial centers for this study. So we've got centers in Arizona, Tucson and Scottsdale, California, and Los Angeles, Murrieta, Orange, San Diego, District of Columbia, Florida, Georgia, Idaho, Indiana, Louisiana, Massachusetts, Michigan, Nebraska, New Jersey, New Mexico, New York, North Carolina, Ohio, Pennsylvania, South Carolina, South Dakota, Tennessee, Texas, Utah, Virginia, and the state of Washington. So we're going to be working with this study for quite some time, I'm sure. And then the third study is a study that we kicked off last spring. And this is the main objective. Let's see here, hold on. This study is evaluating an investigational drug for the potential treatment of IC. And the first portion of the study, it will be compared to a placebo. And the second portion of the study, should you decide to receive another treatment, you will receive the investigational arm. And that's true for most studies, that if you've gotten placebo the first round, they offer you the actual medication the second round. And that is a 46-week study. So all of these are over on the IC Network website, right on the front page. You just have to go down below how the IC Network can help. It's the first line of the blogs. And by the way, I put up our holiday blogs. Our latest holiday blog from Stacy is holiday breakfast ideas that you'll love. So we got a lot of ideas on bladder-friendly recipes here. In my family, it's Swedish pancakes. Swedish pancakes for the win, also known as thin pancake. So it's a pancake literally this big, but it's really, really thin. And we've all become masters at making thin pancakes. Taught by the original Swede, my grandma Osborne. Diane said, I could sign up as I'm close to the South Dakota clinic. My concern is putting on hold any other treatments such as pelvic floor therapy while participating in the study. Well, and that's, you should at least call them and talk to them. Call them and talk to them and tell them about your concern, okay? I'm not sure what their position is on pelvic floor work. I honestly don't know. That's a very, very good question. Okay, hold on. So getting back to Christina. So as you progress with physical therapy and started to feel more normal, yeah, I'm at 3 months with good progress, but it's so slow. Yeah, honey, it's slow because the odds are your muscles have been tight for a long time and your muscles got locked down into tension. We call that vaginismus. It often happens in childhood after a fall, things like that. And so it takes time. You got to work through it. And just, you also have to understand that it's not a one and done. That, if you could injure the pelvic floor again, as I have done a couple of times. But the good news is we can now recognize the symptoms and we know what to do about it. And hopefully, if you learn how to do internal massage yourself with a wand, then you won't even need a physical therapist, that you will be able to recognize it and treat it yourself. Annie said, after a couple of hip and back physical therapy, I'm feeling better. And 3 weeks with no physical therapy, the pain came back. Exactly. And so the most important question you always ask your physical therapist is, are my muscles responding to therapy or are they always locking back down into tension? If your muscles always lock back down into tension, as mine do on the left side, that's when we have to step past the muscles, and we have to start looking at bones. So, for example, the reason why my muscles on this side are tight is because of my joint. My SI joint, sacroiliac joint, is not normal. It flexes. This joint right here, which connects the sacrum to your hip bone, is supposed to be a very sturdy, non-moving joint. When it starts moving, oh, it causes it's so annoying because what happens then is the muscles lock back down, and then sometimes one bone gets stuck on another bone, and SI dysfunction is annoying as hell. So again, it can be a bad hip, it can be an SI joint, or the physical therapist should be looking at your knees. Are you limping? Because if you're limping, believe me, that's going to affect your pelvic floor. But what Dr. Weiss found in his practice, this is why this book is the bomb when it comes to books. What he finally found in his quest to try to figure out why some patients' pelvic floor was always tight, they don't walk correctly. It's about how their foot meets the ground. And so the best picture, so there are a couple of different pictures that I can show you. So here's somebody. So on this side, we have a normal foot, and you can see that the leg is at a right angle straight up. And even though the bone goes towards the side, we're still at 90 degrees. And if we look closely, we can see a normal piriformis muscle. See that? Now I want you to look at this side. You see that this piriformis muscle is stretched out substantially. An inch or two, this muscle is stretched out. Why? So let's go back down here to the foot. This person has an ankle that rolls inward. So we immediately lose the 90 degree. You can already see that the shin bone is at an angle. It's not at 90 degrees. It's at an angle. And that angle is exaggerated in the femur. And that's what stretches out this piriformis muscle and leaves this muscle tight. So bones matter. Your foot matters. You know, so they're going to look for an ankle that rolls this way and an ankle that rolls this way, right? You can have an ankle that rolls inward or an ankle that rolls outward. Those are both going to affect your pelvic floor. Let's see. The vulnerable pelvis is caught in the middle between the spine and the muscles of the upper body and the bones and muscles of the lower extremities. Pelvic problems can therefore arise if there are imbalances in the spine and upper body muscles or in the legs and feet. Yet because there's so much focus on with pelvic pain, let's see. Um, Yet because there's so much focus on the pelvis, structures farther from the pelvis, such as the feet, are unfortunately ignored, even though they may be an important contributor to the patient's pain symptoms. The feet are our foundation, much like the roots of a tree, and as we know, the health of the tree depends on in large measure on the health of its roots. When the root system is damaged or distorted, the tree will bend and twist. When the feet become distorted or are functioning abnormally, the musculoskeletal structure they support will be forced to compensate with resultant distortion that leads to dysfunction. Um, Another condition that can actually cause this is something called Morton's toe. Okay. So Morton's toe. So remember, the human body, the way the human body is built is the bigger the bone, the more weight it's meant to carry. So obviously in your foot, the biggest bone is in your big toe. So normally when you're walking, your big toe carries 80% of the weight. Sorry, there's a hair that's tickling me. So normally your big toe carries 80% of the weight and your second toe carries 20%. And the third, fourth, and fifth toes carry nothing. So, and that's the normal way that weight is supposed to be distributed. But if you have Morton's toe, this means that the second toe is longer than the big toe. And if you look at these joints, this bone right here is longer than this joint. So what happens is when your foot meets the ground, your second toe carries 80% of the weight. Your big toe carries nothing. And then your third, fourth, and fifth toe are now carrying weight that they're not supposed to carry. And hammer toes, you get some people get hammer toes where the toes come down like this. Well, hammer toes are happening because those toes are carrying more weight and they're trying to grip the ground for you. They're trying to compensate for a big toe that's not working correctly. So, as he says here, the first metatarsal must be at least as long as the second metatarsal in order to work properly. When the first metatarsal bone is shorter, it can't do its job of absorbing the stress on the forefoot from walking, standing, and pushing away from the ground. In a perfect situation, Mother Nature makes the first metatarsal as longer than the second, which allows it to carry twice the weight. If the first metatarsal is shorter than the second, when you take a step, the second metatarsal meets the ground before the first does. This blocks the first metatarsal from doing its job of supporting most of the weight. The second metatarsal must now absorb the first metatarsal share of the burden, doing 100% of the work instead of the usual 33%. So it's not 80-20, it's 70-30. Okay. So the good news here is for those of us, so here's an even better picture of Morton's toe. See that? Look at that. And the odds are if you have Morton's toe, you also have hammer toes. Your toes are bending down like this to grip. But there's a very, very easy fix. So I have Morton's toe. And what you do is you get a little piece of moleskin and on your shoe insoles, you do a little circle of moleskin right on your insole, and that will drop it down enough so that your big toe meets the ground first. So I have that in all of my shoes. Helene says, I was told my SI joints are stiff, which coupled with my spine, tailbone, and knee injuries from the military, my gait is completely off, which is causing all my muscles in my back and my hips to be tight. Yeah. So again, physical therapy, we have got to reclaim our bodies here. You know, our lives have become one of sitting and working at computers, and that's just not healthy. And being dependent on others. We have got to invest in learning how a healthy body should behave. And movement is essential. Moving every day, getting up and getting out of that chair and getting out of bed. And that's hard for somebody with pelvic pain. But if you've got pain from muscles and you're laying in bed all the time, your muscles are just getting weaker and tighter. You have to work through the muscle stress to get to the other side of muscle health. And it's not fun, but every athlete does this anyway. It's training. We have to retrain those muscles to be healthy. Helene says, I walk to the extreme outside of my feet and roll my ankles as my body has adjusted to all my misalignment. So that's a problem. So have you been to a podiatrist to work on your feet? Now, I am a huge fan. I completely believe that one of the reasons why I'm better is because I no longer wear high heels and I no longer wear flats without any uh, arch. The shoes that I wear, for the most part, every single day are Hokas. And I think, let's see, Hoka. These shoes are the bomb. They are so good. I can walk for miles as I did this morning. I have about 8 pairs of them now. I'm not throwing away the ones I've worn out, and I should. Um, so I walk much better. Um, my muscles are healthier. The only thing I'm missing now is muscle strengthening exercises. I gotta start doing the gym again. I just gave up my gym membership because of COVID, and I need to go back and do that again. Time to pull some muscles, lift some weights. I mean, not these. We don't want to do that, especially if you got ruptured disc like I do. I'm talking leg presses. I'm talking arm curls, back work, things like that. Diane says, what type of doctor would you see to assess the bone problems that cause IC pain? Or a physiatrist or an orthopedic surgeon? Julie says, you're the bomb, all the knowledge I need. Glad to be your bomb. Annie says, I'm my last 3 vertebrae squeezed. Yep, needle and uncontrollable movement. Yeah, honey, I had that uncontrollable movement myself. Carolyn says, how do I know if I have a muscle issue? When you go to pee, you can't right away. You hesitate 5, 10, 15, 20 seconds, or you can relax enough to release urine, or, well, you come on over to the IC Network website and you can read the other symptoms. Julie says, okay. Annie says, everything started 8 years ago after a C-section. That weird to find blood on my bladder, muscle pain, and reaction. Well, hon, when you have a C-section, structures are injured. And so a couple of things come to mind. Concept number one is Did you sustain any nerve damage during the actual procedure? I mean, because they have to cut through your skin and they have to cut through muscle to get to the baby, right? They have to cut through your uterus to find the baby. So you could have had a nerve injury and a muscle injury, more than normal during the actual C-section. It'd be really interesting to get the operative report from that. The second thing is scar tissue. My sister had 2 C-sections, and the left side of her scar has a very, very strong adhesion that actually connects to like her bowel. And so if she has gas, she has terrible pain from this adhesion, all related to her C-section scar. So we want to look for that. And of course, anytime you have pain, your muscles get tight to protect you from that pain. That's called the guarding response. So your pelvic floor would have naturally gotten tight anyway after that procedure. And it's really sad. It's a sad fact here in the US that our insurance companies will not support pelvic floor physical therapy after having babies, and they should, especially after having surgery like that. Elizabeth said, I'm having surgery for endometriosis. I also have Hunner's lesions. Please pray. Absolutely, Elizabeth. Good luck to you, hun. Good luck to you. Absolutely wish you very, very good healing. And it's going to be very interesting with the endo. Make sure they take pictures for you. You always want lots of pictures when you've had surgery. Because it's important for you to see what the endometriosis looks like and potentially even where it's attached. It's going to be really interesting to see where the endo is and if any of it is attached to your bladder. Also, are they going to be looking at the Hunner's lesions too during that surgery? Laura says she didn't qualify for the Ironwood study due to diverticulitis. Sorry about that, hon. Annie says she has flat feet. She needs orthotics. Yep. Well, go back. You know what to do. Go back and get them. Time for a new set. Carolyn said, I just had a urogynecologist tell me I've been misled because there is no cure. You only treat the symptoms. Well, Carolyn, there's no disease to cure unless you have Hunner's lesions. And that we now know is probably a viral infection. For the rest of us, this is a pelvic pain syndrome for which there are many potential causes. We can treat tight pelvic floor muscles with physical therapy. So your urogynecologist is not aware of the phenotypes. The other area which gets a little bit tricky is the widespread pain phenotype, where those of us who have IC, IBS, vulvodynia, etc., because we have to calm those nerves down. Again, that's not a disease state as much as it is an injury. So, yeah. I think I have a printable fact sheet on the new AUA guidelines that you might be able to give her, or what you could do is just print out the new guidelines. I mean, it's like 50 pages, but print them out and bring them to her. I mean, we are the educators here. Listen, they're lucky to go to one conference a year. Are they going to go take a class at a gynecology clinic, or are they going to take a class on cancer? The odds of your typical urogynecologist taking a class on IC are slim to none. I mean, at the biggest conference in the world, the AUA, 25,000 urologists there, you'd be lucky to get 300 in the IC class. So it is what it is. That's why we become the educators here. And you guys, for anybody who would like a Christmas card, I would love to send you a Christmas card. I just need you to email me your mailing address. If you can email me icnetwork@mac.com, icnetwork@mac.com, I would love to send you a Christmas card. All right, Diane said, Also getting placebo for 21 weeks and continuing with the bladder pain I have. Currently, I do okay during the day, but if I'm careful with diet, but up to 5 times a night. Okay. What type of doctor would do that? Okay. Curtis says, I sent you an email if you have time to read it. Thanks a bunch. Appreciate you. Diane said, my pants hang lower on one leg than the other. Would that mean my bones are off? Probably. Probably. All right. I need to pee. Quick bathroom break. Be right back. All righty. Well, see, I counted it 7 seconds. It took me 7 seconds to relax enough to release urine. So that's the question that I ask patients, and they, when I if I'm working with them or we're subtyping them or phenotyping them, I say, okay, when you go to urinate, can you start on command or do you hesitate? How long does it take you to relax enough? And it's fascinating. It's absolutely fascinating. So what does that tell me? It tells me my muscles are tight from me sitting here, and it's going to be good for me to do a little bit more pelvic floor work. A. Helene said, would I suggest breaking through chronic pelvic pain or headache in the pelvis? Oh, easy choice. Breaking through chronic pelvic pain. I haven't heard. I mean, listen, it is a game-changing book. It's like you're just going to have to study. The first 3 to 4 chapters are going to be educational. It's going to be like being in a physiology class. But you got to learn where the muscles are. You got to learn where the nerves are. I want you to be able to visualize the muscle they're touching when you're having your pelvic floor exam. I want you to be able to know the name. I want you to be able to say, how's my piriformis? How's my obturator? How's my levator? And the way you get that is by reading, but you're going to have to read and study. I mean, this is why you're going to find, look, I'm studying. Like you find important things highlighted for me. Trigger points, or technically myofascial trigger points, are hyper-irritated spots within tight cord-like bands of skeletal muscle. They often have a knotty texture, are painful when pressed, and have a tricky way of referring pain to other areas of the body. So get a highlighter. And I didn't just highlight, I highlighted diagrams too. I mean, like this was the book that made me such a better educator. Really helped me so much. And it's just filled with good case studies, good successful stories. Robin said, dealing with IC, IBS, pudendal neuralgia. I absolutely love that I found you. Oh, Robin, well, gosh, you just made my day. Thank you, hon. And you're not alone because I am, or I was, an IC, IBS, and pudendal neuralgia patient too. But now that I've gotten my muscles healthy, my IC symptoms are for the most part gone. My IBS for the most part gone, and the pudendal neuralgia. Every now and then, if I sit too long, I mean, my muscles. When we think about the concept of cause versus effect, my underlying cause is absolutely muscle driven, muscle and nerve driven. It was never my bladder. And Don says, why not read both? Breaking Through Chronic Pelvic Pain is excellent. Um, and Breaking Through Chronic Pelvic Pain is free and Kindle Unlimited. So no excuses. If it's free, get it. The only problem with a Kindle is you can't highlight. And I think it's important to highlight. You need to be able to come back and look at it over and over again to really understand the complexity of pelvic pain, because you are an anatomical mystery to be solved. We have got to find the underlying cause for your symptoms, because in most cases, it's really not the bladder. Caroline says, not going back to that doctor, no way. Yeah. Well, it's tricky, my friends. It is tricky. Now the sun is going down. It's getting cold, so I'm going to put my hat on. Is it centered? Oh, wait, it's not centered. I want to get it centered. Why not be goofy? We can be goofy too, right? It's okay to be goofy. Are my lights blinking? There we go. All right, guys. Well, I don't even know. How long have we been going right now? I will be 3 hours very, very soon. So I am here as long as you have questions. So give me your questions. And I want to show you my most precious Christmas decoration, which I brought out. Look at this. Isn't she gorgeous? She's like a Christmas snow queen. I don't know. I think I got her like 20 years ago. And I just love her dress. But her hat falls off. Oh, see, your hat fell off. So may she give you an extra Christmas wish or two. Let me just see if I can find. Here you go. Here you go. Let's do a case study. This is a patient with, okay, hold on. See, the problem with jeans is jeans are uncomfortable sometimes. Okay, case number 2, urgency, frequency, and urethral pain. A 63-year-old woman came to see me with a history of recurring urgency, frequency, and urethral pain, but without infection. Examinations revealed tight hip rotator muscles with trigger points. I released the trigger points with internal manual therapy, to which she responded positively. However, she continued to have pain flares. While my treatments were effective in the short term, the results only endured for variable periods. I continued to administer periodic therapy for nearly 10 years. Now, at the time of our last visit, armed with new knowledge, I looked at her feet and noted unusually high arches. When I asked her if she had experienced any of the potential side effects of such an abnormality, she came out with bilateral Achilles tendonitis, knee surgery, and more recently, hip pain when awakening or rising from a crouching position. In my mind, I visualized a straight line of mechanical stresses. It began with a foot imbalance, which affected her Achilles tendons, then the knees, the hips, and ultimately the pelvic floor. A visit to the podiatrist was the last step of her healing journey, and it is unlikely she will require many, if any, additional sessions from me. 10 years ago, when I first saw this patient, the feet seemed too distant from the pelvis to be considered in the treatment plan. Experience has taught me otherwise. Okay, here's another one. A 42-year-old man with voiding difficulty reported that at age 14, he had severely fractured his left foot, leaving him with a short leg. Since that time, he had assumed many abnormal positions when sitting to protect the leg. Within a year or two of this injury, the voiding difficulty began, and he was too embarrassed to mention the problem to his parents until another year had passed. He was subsequently found to have tightness of the pelvic floor muscles, which is typical of voiding problems, and had limited success with manual therapy and biofeedback administered by another doctor. When I examined him, the short leg was apparent, as well as externally rotated legs and a severe overpronation of the feet. And a visit to the podiatrist proved to be the missing link in his treatment. Now, here's another case of vaginal and vulvar pain. A 31-year-old woman came to me complaining of vaginal pain during intercourse. The symptom was completely alleviated with manual therapy for tight pelvic floor muscles and trigger points of the internal hip rotators that I had noted upon examining her initially. However, the patient then began to notice vulvar pain when she exercised, which I surmised had been there all along but was masked by the predominating vaginal discomfort. Not infrequently, localized pain receptors or pain responses present themselves in the order of magnitude. Only when the initial discomfort clears will the patient become aware of subsidiary distress. Ongoing diagnosis is required. In the course of treatment, it's rather like peeling an onion, removing one layer at a time. When I re-examined this young woman, I found nothing in the vicinity of the pelvis that might be causing her vulvar discomfort. However, this time I scrutinized the lower extremities for clues to her new symptoms and noted extremely high arches, which were no doubt the cause of the previously noted noted hip rotator trigger points. I referred her to a podiatrist who fitted her with orthotics, and the vulvar pain disappeared. This is one of the cases that led me to realize the importance of a routine biomechanical assessment at the time of the first appointment. Right? All right, hold on a sec. All right, hold on. There's even a story about John F. Kennedy in here. All right. Okay, here we go. Here's another one. And this one's on Morton's toe. Another recent patient provides a striking example of I'm going to sneeze. Hold on. Okay, we'll see. A striking example of the body-wide implications of Morton's toe. At the young age of 26, Kelly had been suffering for 7 long years with vulvar pain during sex and had been plagued with lumbar, upper back, and jaw pain. She also had a history of right Achilles tendonitis after running a marathon. At the time of her first appointment with me, she was being treated by a physical therapist with vaginal dilators and also receiving manual therapy for her back. And as I began my external examination, the first thing I noticed was that Kelly had bilateral Morton's toes with all the trimming. Um, there were calluses under her second toes, bunions and overpronation, as well as trigger points in the right piriformis muscle that rotates her hip, and skin sensitivity around her sit bones and rectum. My internal examination then revealed a sensitive right pudendal nerve and a very tender and tight right piriformis muscle. When I attempted to manually release the piriformis internally, I found that it would not budge. In these stubborn cases, I revert to my acupuncture training. I applied acupuncture to the point on the outside of Kelly's right thigh that her middle finger would touch if she was in a standing position. This point was extremely tender just as I was compressing it. Kelly thought to mention that she had been suffering from right hip pain. The piriformis released with this simple acupuncture technique. The hip felt better and the pudendal nerve sensitivity disappeared, along with skin sensitivity around the sit bones and anus. At this point, everything seemed to come together. Because of her back pain, I checked her quadratus lumboreum, a muscle that attaches to the back and sides of the pelvic iliac bone. As suspected, it was tightened with trigger points that commonly refer pain to the low back and sacrum. Now the light became even brighter. Kelly's Morton's toe was causing tension in her in her right, in a tendon. Okay, and this was the side of the tender. Okay, this is a long story. Anyway, it goes into it was also causing a tendon pushing on a nerve. So here's a take-home message. If you're suffering from chronic pelvic pain symptoms, you may have biomechanical problems with the sacrum or feet that are causing your problem or contributing to it. It is therefore important to observe your own body for signs of pathology that should be called to the attention of your doctors. Number one, put on a skirt or a pair of pants and stand in front of a full-length mirror, feet pointing forward and a few inches apart. Now observe whether your hemline dips on one side or whether one pant leg is longer than the other. Didn't somebody just say they had that? Number two, wearing undergarments and no shoe. Wearing undergarments and no shoes. Stand in front of the mirror again, feet forward. Are your arches excessively high or flat? Is one arch obviously higher than the other? Are your feet turned obviously inward or outward? Are your knees bowed outward or inward? Is one hip higher than the other? Then check the soles and heels of your shoes. Are the wear patterns uneven, signaling overpronation or excessive supination? And check your feet. Do they show signs of Morton's toe? Yes answers to any of these above questions suggest that you should speak with your treating physician about obtaining a biomechanical assessment from the appropriate specialist. I am continually amazed by the number of people I see walking and running on the jogging path in my community whose lower extremities are tracking improperly or otherwise compromised. And as I observe them, I find myself wondering what kind of pain they might be experiencing at that moment or likely to experience in one day, and wishing that I could take the liberty of suggesting that they seek help. The purpose of this book is to educate you about your pelvic pain condition with all of its complexities and ramifications so that you may proactively participate in your own care. Breaking Through Chronic Pelvic Pain. Best book you can have. Merry Christmas to you, Dawn. Dawn, Merry Christmas, you guys. All right. Well, if nobody has any other questions, I think we're probably done. So last call for questions. Last call for questions. Anything? All right. May this coming week bring you peace. May this coming week give you healing. May you feel in more control. May you find comfort. May you find joy. And I wish you joy. And I hope that you'll spread it to everybody that you meet, because we are in this lifetime journey together, and we should be trying to make life easier for the people around us too. So spread the love, spread the kindness, spread the Christmas cheer, and I will see you again next Sunday, hopefully. And then you're not going to see me for a couple of weeks because Christmas Eve is on Sunday and I will be at my best friend's. And New Year's Eve is also on a Sunday. And so, unless somebody has COVID and I'm here alone, then I want to be out and trying to enjoy the holiday. So, peace to you all. Be well. And if you need to talk, please feel free to give me a phone call. 1-800-928-7496. All right. We're going to say goodbye to Facebook first. All right, Facebook. See you later. All right, you guys on YouTube. Somebody said something here. Oh, Curtis. Curtis, are you still here? Do you want me to check that email right now? If you're still here, I can do that. Let me see. And I will see if it's something I can answer publicly or not. Curtis, I don't see. I don't see an email from you, hun. Let me check my junk folder. icnetwork@mac.com. icnetwork@mac. M as in Mary, A as in Apple, C as in Charlie.com. I do not see it, hun. So if you want to resend it again, or give me a phone call this week, that would be fine too. Okay. Have a good week. Be well. Be strong. Pat yourself on the back. You're doing a good job. And you are not alone. Carry hope in your heart. Use your affirmations. I could go on and on.